This is Kevin Gregg from Mississippi in the United States of America. You are tuned into DJ Tommy G on 89.5 Subic Bay Radio.
Coffee? Check. Shower? Check. The best morning show on the radio? Check. Start your mornings right.
Right here on 89.5 FM.
89.5 Subic Bay Radio. We are back. This is still the Morning Brew Radio Show. Well, we're just gonna call it the Brew dahil hindi na morning. 12:21 in the noontime. Time check brought to you by PLDT Fiber. Nothing beats fiber, so upgrade to home's most powerful broadband. Call them up, 252 Fiber or 252-3427. All right, PLDT Fiber, that's the hotline number for PLDT Fiber here in the Subic Bay Freeport Zone. All right, and right about now, our viewers on the official Facebook page of 895 Subic Bay Radio, you guys can see a different window on our live streaming right now because we're going to promote something that's, I feel this is very important, syempre. It's about a webinar that will be happening, and to give you further details of that, hayaan na natin na yung mas nakakaalam ang magpaliwanag. What's the webinar all about, ladies and gentlemen? Please welcome Dr. Angelica Fortaleza to tell us more about it. Hello po, good afternoon.
Good afternoon, DJ Tom.
Good morning.
It's nice to be here.
Oh, likewise po. Ayan, so I heard you guys will be having this very important webinar. What is it all about?
We are holding a webinar tomorrow at 10 o'clock in the morning, and it's entitled The Impact of Climate Change and the Environment on Our Health. This will be focused on the employment sector, meaning all the employees, all the working group, like every one of us. And of course, the community residents, we are all in, at the end of the day, we are all moms, we are all dads, we are all ordinary citizens. And this will serve us good purpose to join us tomorrow. It will deal on how our environment affects our health, how the chemicals that we are exposed to will affect our health.
Okay, all right. So this will be on, kailan nga po ba ulit?
Tomorrow po ito, June 29th at 10 in the morning. It will play around roughly 2 hours, and we will have a bunch of speakers with us. I will be included there, and my colleagues, Dr. Dennis Delgado and Dr. Maria Cristina Santos, they will talk on different topics as well. And this is in collaboration with Subic Ecology Center, the Subic Freeport Chamber on health and environment conservation, and most especially Philippine College of Occupational Medicine Olongapo chapter headed by Dr. Evelyn Natividad, and also the Central Luzon Occupational Health and Safety Network, as well as the Subic Residents Community, and a lot more. And also, before I forget, this will also be supported by the Olongapo Medical Society. So, all doctors po kami bukas. Tapos, meron po tayong guest din na magsasalita galing po sa Department of Environment and Natural Resources. Siya po ay magsasalita na parang inspirasyon from Mr. Albert Magalang.
All right. Nice.
This will be hosted by Miss Jen Bellarmino. If you know her, sir.
Yes po, I know Ma'am Jen. The beautiful Ma'am Jen. Yeah. Awesome. Okay, kanina I was called by tinawagan ako ni Dr. Eve Natividad telling me about this. Alam mo naman, alam ko pag si Dr. Eve ang tumatawag sa akin at kinukuha ng attention ko, alam ko na something important ito eh. Kaya hindi natin napapahindian yan si Dr. Hi Dr. Eve, if you're listening. Happy listening to you.
Ito ay nakikinig ngayon. Tapos yun nga po, siyang aking dito katuwang sa proyektong ito, sir.
Yeah. Kayo rin, huwag nyo na po kung tawagin, sir. Huwag din, ma'am, ha? DJ Tommy na lang. And part din, of course, I have to mention this nga pala, si Dr. Fortaleza is the regional representative of Philippine OB/GYN Society Subcommittee on Reproductive and Developmental Environmental Health. Wow, awesome. Okay. Ang title ng webinar is Climate Change is a health emergency. Definitely it is. Ayan. So would you like to tell our listeners more on what's gonna be happening here? A little siguro, parang teaser lang ng konti kung ano yung mangyayari. Kung join sila, what will they be getting? Ano yung ma-acquire nilang, I'm sure, dagdag kaalaman. Webinar eh. Yeah, okay.
Opo, sige. So ang webinar na po ito ay...
Hi, it's okay. Hi, little boy. Your son.
Excited siya, opo.
Yeah.
This webinar will have 3 lectures. The first one is entitled Climate Change, How It Affects Our Health, and the Current Environmental Health Situation. This will deal with current updates, how our global temperature is rising by 1.5 degrees Celsius by within a span of 5 years, and we are exceeding the limit that we are supposed to. So malalaman natin dito kung bakit tayo nagkaka-COVID-19 pandemic in relation to climate change. Kung hindi natin po na-realize pa hanggang ngayon na itong pandemya na ito ay konektado sa climate change.
Actually, you know, I'm getting goosebumps right now when you said that. I'm getting goosebumps.
So, kung maaalala nyo, for how many years we were struck by dengue, the famous mosquito or the vector-borne disease dengue, as well as leptospirosis. But this time, we are being struck with a global pandemic, which is the COVID-19. So kung wala tayong gagawin mga paraan o solusyon para magbago, para protektahan ang ating planeta, baka hindi lang po ito ang ating abutin. Kaya po nakalagay dyan sa title na Climate Change is a health crisis and a public health emergency. Kasi hindi po natin nararamdaman, di po ba, pagka tinanong kayo, ano bang ang naaalala mo, or what comes to your mind when you hear the word when you hear the words climate change or global warming, parang naiisip natin yung mga sea level rising, yung parang mga ice melting, and ganyan. Pero parang hindi natin na-feel, nararamdaman, hindi natin naaamoy, hindi natin pa na masyadong nararamdaman. Ngunit kung may mga baha, kung may mga natural calamities, diyan na maaalala natin na ang mga ginagawa natin or yung tinatawag nating human-driven activities na nakakaapekto ng ating environment. Doon pa lang natin marirealize na meron ba tayong contribution sa climate change? Siyempre, natural, meron po. Tayo po ang may kagagawan nito. Tapos, kung ano ba yung pwede natin gawin para masolusyonan, ma-prevent, ma-mitigate, or better yet, to adapt, how to adapt. So ito po yung mga masasagi nating mga mga topics. Pangalawa, yung pong isa nating topic ay about chemical toxic substances in our environment. So kung hindi natin napapansin na lahat po tayo gumagamit ng anything na may plastic. Siguro po naman lahat tayo nagsisipilyo. So gumagamit tayo ng toothpaste, gumagamit tayo ng shampoo. Lingid sa ating kaalaman, meron itong mga content na pwedeng makaapekto sa ating kalusugan. So ang isang very concerning po dito ay yung kung nabalitaan nyo or napansin nyo po ba yung isang news or written from the New York Times, no, that the sperm count of males are declining by 52.9% from 1973 to 2011.
Well so aware of that.
Parang matatawa yung iba. Pero actually, this is not a laughing matter. This is a very serious matter because in one way or the other, in 30 years, baka pwede tayong maging extinct. So nagsimula po itong mga research na to sa mga pag-aaral ng ibon, ng fishes, ng frogs, na nakikita nila na ang pagre-reproduce nitong mga animals na to ay bumababa. So kung sila naapektuhan doon sa environment, malamang tayo ring mga mankind, no, tao. Kasi pare-pares tayo ng environment na kung saan tayo nabubuhay. So, yun. So, ito po ay base sa mga nailathalang research. So, this is all evidence-based, hindi po ito chismis, no? Another thing is yung incidence ng ADHD or Attention Deficit Hyperactive Disorders. Ito yung mga neurodevelopmental behavioral disorders in children. Kung hindi pa po natin na naririnig po, ang pinakamataas na ng autism and ADHD ay sa Hong Kong. Nakakalungkot pero the incidence is about 200 plus in every 100,000 children would be affected with autism spectrum disorder or ADHD.
Oh, wow.
In California alone, 1 in 54 children develops autism or ADHD, yung mga ganun pong neurodevelopmental behavioral disorders. So this is very concerning, pero kasi lahat po tayo magulang. Maaring ang iba sa ating mga tagapakinig ay gustong magbuntis in the future, or kung meron na kayong mga naunang anak na wala namang problema, parang gusto niyo pang sundan. Pero di ba nakakabahala paano kung yung pangalawa, yung sunod kong anak merong ganitong disorder.
Yes.
So these will be the topics that will be covered tomorrow at 10 o'clock. Another speaker will also talk on solutions. What can we do and how can and when can we start? So the answer is now and today. So ayun po mga kaibigan, mga taga-kapakinig at ating mga viewers, we are inviting you, the Philippine Obstetrical and Gynecological Society Central Luzon Chapter, Subcommittee on Reproductive and Developmental Environmental Health, ang haba po is inviting you to join us in this webinar. This is an advocacy on reproductive health and of course, planetary health. Marami po tayong mga inimbita para tayo ay tulungan at suportahan. Pwede po kayong magtanong at sa aming makakaya ay sasagutin namin ang inyong mga katanungan. Ito po ang aking.
Hi! Alright.
Ayan po.
There will be resource speakers.
Thank you, sir.
Yeah. Okay. So, ayan, for those who wanna join, what do they need to do po? Sa mga gustong mag-join, ano pong kailangan nilang gawin?
Mayroon po kami ipapadalang announcement which includes the registration link as well as so pag magre-register po sila, meron lang doon mga ilang katanungan, tapos po automatic po na maa-approve na. And then, meron lang ilang mga katanungan doon like yung kasama po doon yung email at saka yung sabihin na nating industry, saan po silang organization like medical ba, business, manufacturing or whatever, ganon. All the optional naman po yung iba. And then, we will send you an email containing the link to the webinar. At the end of the webinar, we will also provide an e-certificate of attendance for appreciation naman po sa inyong pagdalo. At saka, ito na rin po yung aming paraan na makuha din po yung list of attendees para po meron din kaming partly documented naman sa aming on our end. Pero yun po, madali lang naman po. We will send you later on also sir, the poster and I think you have it right.
Yes
and
po,
then the registration link. So dun po sa
it's in our screen right now.
Okay.
Sa live stream natin.
Yes, salamat po. So pwede natin itong ibahagi kasi we have a 1,000 seat capacity for the webinar. And then we would love to have you all as much as we can. Kung lalagpas po tayo dun sa kung lalagpas po tayo sa 1,000 na audience, this will also be aired on Facebook and probably YouTube on live stream. So parang doon po sila may ipapadala po namin yung link po tsaka invitation. So it's very easy to join naman. Basta register and then you will receive the email containing the link to the webinar.
Okay. And if I may, maybe perhaps I can also share well, they have to register first, yung mga gustong sumali nga pala, no? Yeah, okay. And if they wanna register, where do they go? What do they need to do if they wanna register?
If they want to register, Kailangan po kasi ma-receive nila yung invitation ng Zoom meeting. So, yun po yung very first. So, pagka na-receive na nila yon either through a chat group or sa messenger or dito po, i-click lang nila yung link, pupunta na po siya dun sa registration. So, in one way or the other, we will find ways. Kunyari po, hindi kayo napadalhan through messenger dito sa Facebook. Paano bang gagawin natin, sir? Sa inyo ko po ibibigay. Tapos kung paano natin maipapaabot sa kanila. Kasi it's just actually a message that we can copy and then paste. So it should be that easy, sir.
Yes. Is there po a page that they will reach out or pupuntahan na page, Facebook page or official website?
Oh, yes. Ganon? Okay. Yeah. Thank you for that.
Yes, ma'am.
Very interesting. Sa Subic Ecology, if you go to the Facebook page of
there you go. Okay.
Subic Bay Ecology Center, it will be posted there, as well as if you're a resident in the Subic Bay area, it was already posted in the Subic residents community.
Oh, okay.
And let me just ask also my colleagues where else. Pero if here in 89.5, maybe po sa page natin.
Yeah, I can post it too. Yeah.
Just for 24 hours, just share our poster.
I think yung link is naibigay ni Dr. Eve. Eto, nakita ko na nasa Messenger. Ayan, register in advance for this webinar. And then the link. There you go. Along with the poster. Okay, ayan.
So yung link po talaga kailangan po pumunta pa sa registration just for us lang to filter everyone. Pero yun, welcome po ang lahat. This is supposed to be a lay forum for community, for everyone. So we're holding a different one for doctors and medical personnel in a latter date. But this one po, welcome po sa lahat. Kagaya nga po ng sinabi ko, kahit kami mga doktor, pag uwi namin ng bahay, we're just ordinary people. We cook, we use shampoos, we use detergents, and we wash our clothes too. So this is for everyone.
Yes, definitely. Climate change is everybody's concern. Di ba malapit na yung meron ngang deadline di ba? For the average temperature of the planet to lower. Lalong-lalo na yung mga highly industrialized country, sila yung pinipress natin lalo dyan dahil sila yung huge contributor sa warming of the planet. Di ba? Those countries. Hindi ko na sasabihin yung countries, pero sila paring paring John.
Ayun nga po, sir.
Isa na siya.
Parang, di ba binigyan po tayo na hanggang 2030? So
there you go, hanggang 2030.
This was included in the United Nations Sustainable Development Goals na 2030.
Yeah, lapit
so,
na.
We roughly have how many? 9 years na lang po,
9 years or so, yeah.
Di ba po?
Yes.
So mga ganon. Isa pa, babanggitin ko na lang din po na it's very sad na ilalathala ang ating dadawit ang ating country sa most impacted country doon sa climate change. Ang ibig sabihin po nito, kapag kasagsagan ng mga ganitong pangyayari, tayo yung apektado. Ironically, the countries who are responsible for greater number of emissions, sila yung less impacted by climate change. Kumpara doon sa mga countries na hindi naman ganon kataas ang carbon emissions or hindi lang carbon kundi pollutants. Po, bakit? Siyempre po, mauuwi tayo sa ekonomiya dahil sila mataas ang kanilang per capita, ang kanilang GDP, meron silang budget for health, for para sa mga risk and disaster management, meron silang nakalaang budget dyan. Samantalang tayo, nandun tayo sa mababang estado, so tayo ang maapektuhan. Kagaya ng dyan na ang India, Bangladesh, yung mga ganito. At tayo po, Pilipinas. At saka syempre po, Africa.
Yeah. Kung tawagin tayo yung nasa nganga estado. Parang gano'n.
Siguro makakalungkot. Kasi kapag tinignan,
Opo. In layman's explanation, to put it simply, eto si yung big countries, ang lalaki, nagkakalat, nagtatapon, kanino bumabagsak? Sa maliliit. Ayun, binabagsakan yung maliliit. Parang ganon.
Parang ganon.
Yeah.
Yung epekto. Kunyari na lang, bigyan na lang natin ng mas simpleng halimbawa, sir.
Opo.
Kung nagkaroon na ng matinding pagtaas ng temperatura, so masyado nang mainit, yung mga naandun sa mayayamang bansa, kaya nilang mag-provide ng air conditioning, ganyan, dahil nga, Tapos kung magkakasakit ang mga tao, merong budget ang kanilang government for health assistance. Samantalang tayo, kapag ka nag-suffer na, pagka nandyan na yung napakataas na temperatura, anong mangyayari? Marami nang maapektuhan, maraming magkaka-heat stroke. Hindi naman lahat mapoprovide na natin ng health assistance dahil nga sa estado natin sa ekonomiya. At hindi naman lahat mapoprovide na natin ng aircon.
Yeah, exactly.
So, mas apektado tayo with regards sa health. Talong-talo tayo. Kaya kung wala tayong gagawin, matatalo tayo ng climate change.
So the time to act is now. I know you guys, they might say, teka, 9 years pa yan, matagal. Pero hindi, mabilis lang yan eh. In a task like this, kailangan na mahabang panahon eh. Hindi to madaling gawin eh. Mahirap to, kaya kailangan talaga the time to act is now.
Yes.
Yan. All right. Okay, so anything else you would like to add to that? Kung wala na, siguro it's greetings time. Pero baka may dadagdag pa kayo, Doc. Sige po.
Wala naman na po na banggit ko na po lahat ng aking maalala, pero yun lang, I would like again to invite our viewers and our listeners, if you kung naman po wala silang panahon, may mga recordings naman po ito na maaari naman nating i-publish later on din po yun. Tsaka mapapanood nila yan sa YouTube tsaka sa Facebook. So yun. Pero
nice.
If they can share the link as well, welcome po. Marami naman po tayong as far as I have checked kanina po, nasa pa lang yung registrants. Wala pang 500. Kaya we have another 500 seats more.
Oh, nice. Okay, so again, everybody's welcome to join. Lahat po tayo pwedeng sumali. The webinar about the climate change. Climate change is a health emergency. Ayan. Sabi ni Doktora Ib, batiin daw natin yung all the members of Olongapo City Medical Society and the PCOM OC. What's PCOM once again?
Philippine College of Occupational Medicine Olongapo Chapter.
All right. Ayan, lahat po sila. If you know the names, sige, go ahead.
Okay.
Baka marami yan.
Sige po, babanggitin ko na po. This is our way to thank them as well for joining us in this project. So first, from the Philippine College of Occupational Medicine, Olongapo chapter headed by Dr. Evelyn Natividad. From the Subic Ecology Center, si Miss Amet po, nandiyan siya.
Koval.
Yes, si Ma'am Amet. Ayan. Sa naman po sa Subic Residence Community at saka sa SBF Chamber of Health and Environment Conservation. Also, she's the head of the Philippine Central Biodiversity Center for Philippine Biodiversity Journalism, si Miss Jen Villarmino.
Ma'am Jen.
Sa Olongapo Medical Society naman po, Dr. Raymond Joseph Manzo. He's the current president, 2021.
Yeah.
Ayan po.
A good friend of mine. We play basketball. Dr. Manzo. Yeah.
Opo. Meron pa ba ako nakakalimutan po? Central Luzon, yung aming pong society, nabanggit ko na po kanina, Olongapo Medical Society. Miss Ametia Cobal pala, yun sa ecology.
Okay.
Yun po. Yun na po. Mukhang, so bukas, magiging exciting po ito. We'll make it very dynamic and magkakaroon tayo ng question and answer, yung mga yan, para para involved naman, maging engaging ang ating activity, ang ating webinar.
Yeah, okay. And it starts at 10 o'clock, am I right? 10 in the morning?
10 o'clock po, yes.
All right. Okay, so there you go. Maraming salamat, Doktora Fortaleza. Well, do you happen to be related to Barbie Forteza pala yun, I'm sorry. Iba pala.
Baka po yung husband ko.
All right. Thank you for joining us.
Po, maraming salamat po, DJ Tom. Yun, sige po.
Thank you for joining
we'll
us
see
here.
you all tomorrow po.
Maraming salamat po, and thank you for sharing this beautiful piece of info sa ating mga tagapakinig. All right.
You're welcome po. Always happy to be here, sir.
All right. Thank you once again,
Okay,
Dr. Fortaleza, here on the Morning Brew Show. All right, so back to the Morning Brew. Fun and music continues, so please do stick around. For the meantime, we're gonna play this song from Tommy Lee featuring Butch Walker. This is Good Times, 895 Subic Bay Radio.